Good evening and welcome, everyone. Thank you for joining us. We're so excited to have you here. We're going to wait maybe about one more minute before we get started. But as you're waiting, you should see a question on the screen. Take a few minutes to think about the answer and place your thoughts in the chat. We will be sure to get to the answer during tonight's presentation. Welcome to 3 days of connection and care. Chronic kidney disease awareness, resources, and education. As a reminder, this webinar is being recorded and will be made available to everyone who would like to view it again at a later date. This event is sponsored by a grant from Baxter International and the central area of the Links Incorporated. The primary goal of the Black K.A.R.E initiative is to raise awareness of chronic kidney disease, also known as CKD, in Black communities, with a focus on its risk factors, complications, treatment, and how to reduce the risk of kidney failure and/or improve outcomes for people living with this condition. This event is hosted by the Nashville, Tennessee chapter of the Links Incorporated and is produced in collaboration with the Music City, Tennessee and Parthenon, Tennessee chapters of the Links Incorporated. We are proud to extend a warm welcome to our 2021 healthcare partner, Metropolitan Interdenominational Church First Response Center, and our new healthcare partner, Meharry Salt Wagon Clinic. We look forward to supporting both organizations and the communities that they serve. My name is Dr. LaMonica Stewart, and I am a professor in the Department of Biochemistry, Cancer Biology, Neuroscience, and Pharmacology at Meharry Medical College. I am a proud member of the Nashville, Tennessee chapter of the Links Incorporated and will be your moderator for the evening. Tonight, we will begin the first of a 3-part series by hearing directly from the experts who will inform, uplift, and inspire us to take charge of our health. We will begin with a general overview of chronic kidney disease from Dr. Umeukeje, who will focus on risk factors and screening. We will also hear from Dr. Dewey, who will provide an overview of wellness in the context of kidney disease and give us strategies for healthy goal setting. We will then end our session with time for questions and answers from both speakers. Be sure to join us next week for a discussion about CKD and the Black community, for we know that we are at higher risk for severe disease and need to be armed with strategies for early detection and prevention. Nutrition and exercise are wise prevention strategies, and we have a nutritionist and personal trainer who will provide expert advice. The last session will focus on our faith and our health. For many, our faith is an integral part of who we are. Many of us wonder how we can use our faith to better prioritize and support our health. We will have a lively conversation about this on February 2nd. Now, the Zoom link that you used to enter today's session will work for our webinars on January 26th, which is next week, as well as February 2nd. If you have questions for our speakers, please use the Q&A button. During the course of the hour, you can enter comments into the chat. Let us know, for example, where you're from. Are you a member of a Links chapter? Or are you a member of one of our church partners, St. Vincent de Paul or Metropolitan Interdenominational Church? Stay tuned for information about our K.A.R.E giveaway. For everyone who completes at least 2 sessions will be entered into a drawing to win a $30 gift card, and those who complete all 3 sessions will be eligible for a $50 gift card. We will have more information about that at the end of the session. As a reminder, always seek the advice of your physician or other qualified health provider with any questions or concerns that you may have regarding your health. To find out more information about Black K.A.R.E and chronic kidney disease, please scan the QR code on the screen or use a link that will be entered into the chat. Now, we will begin by welcoming our faith-based partners and saying a few words about the Meharry Salt Wagon Clinic. Dr. Edwin Sanders is the founder and senior servant of the Metropolitan Interdenominational Church. Reverend Sanders and his congregation have been vital partners with the Nashville Links Black K.A.R.E grant, and we are so excited to work with him and that church again this year. Tonight, Reverend Sanders' wife, Mrs. Billy Sanders, who is also a member of the Nashville chapter of the Links Incorporated, will bring greetings on his behalf. Welcome, Link Sanders.
Thank you. I wish to bring greetings and welcome all who are in attendance on behalf of Metropolitan Interdenominational Church and on behalf of my husband, the senior servant. We have an outreach ministry, the First Response Center, who is delighted to partner with the Links again this year for the K.A.R.E project. We just hope that everyone on this webinar will find something that helps them to improve their health or improve their health, the health of others in their sphere of influence. I'm also just grateful and delighted that the people who are going to be presenting on this seminar are people in our local community, and we are so blessed to have these types of healthcare professionals in our community that can share the type of information that we're about to receive. So again, welcome.
Thank you, Link Sanders. Now, help me welcome Deacon Harry Guest and L.B. Gators from St. Vincent de Paul Catholic Church. St. Vincent is one of our newest faith-based partners. We are so excited to have you join the webinar series, and we are looking forward to the community health fair that you will offer with the Links and the Salt Wagon Clinic on March 25th. Deacon Harry, would you like to say a few words?
Yes, thank you. And I'm delighted to be a part of this. I think it is a wonderful effort to do more for the people in our community. We're very good at St. Vincent about outreach with physical resources, food and that kind of assistance, but we need to do more clearly on health issues. And so we're delighted to be able to host on the 25th of March for the health fair. And we look forward to doing even more in the future.
Thank you, Deacon Harry. We are so glad to also have L.B. Gators, a valued St. Vincent parishioner, join us as well. L.B., thank you for helping to moderate tonight's Q&A session.
You're quite welcome. I'm glad to be here with you all, and I do recognize the Links and how much we have to do for the community. St. Vincent, as our deacon said, is ready to do more for our people, especially with health issues. So thank you for having me, and I'll do all I can to get this computer stuff right.
Thank you again, LB. The Meharry Salt Wagon Clinic is a student-run clinic with a rich history of service to the greater Nashville community. They provide so many vital services, including kidney disease screening, COVID-19 education, and COVID-19 vaccines. Welcome, Salt Wagon Clinic faculty. We are looking forward to working with you. It is now our distinct pleasure to introduce Sharon Roberson, President of the Nashville, Tennessee chapter of the Links Incorporated, who will offer greetings and present our first speaker. I just want to note that Link Sharon serves as President and CEO of the YWCA Nashville, Middle Tennessee, an organization whose foundation is justice for all. Welcome, Madam President. All right, I am looking for Madam President, but she may be having some technical difficulties. So what we will do is we'll come back to Madam President. We'll give her a few minutes to kind of rejoin us, and we'll go ahead and transition to our first speaker. Our first speaker is Dr. Ebele Umeukeje, who is an assistant professor of medicine in the Division of Nephrology and Hypertension at Vanderbilt University Medical Center. She is also the chair of the Diversity Initiative for BUMC Nephrology Division and a member of the Diversity Committee of the American Society of Nephrology. She performs research, and that research aims to address kidney health disparities, especially those mediated by race, by optimizing self-care, including medication and treatment adherence in vulnerable populations, and addressing psychosocial health determinants to promote kidney health equity. She has expertise in understanding the priorities of the Black community regarding screening for chronic kidney disease and APOL1 high-risk genetic variants. Welcome, Dr. Umeukeje.
Thank you for that warm welcome. It is my distinct honor and pleasure to be here with you today and to have the opportunity to give this talk. Next slide, please. I'll start by sharing a case of a 43-year-old African-American man who presented to the emergency room complaining that he was not feeling well. He had no known past medical history. His blood pressure was elevated at 190/110. And his oxygen saturation was low. He appeared volume overloaded with marked facial puffiness, leg swelling, and crackles in his lungs. His urine was positive for protein, and his lab results were notable for serum glucose of 400, creatinine of 10, and eGFR of 6 mL/min. The patient was immediately admitted to the hospital, and an urgent nephrology consult was placed. Keep this case in mind, and I'll circle back to it at the end of my talk. Next slide, please. The kidneys filter 25% of the blood pumped by the heart. And with all due respect to all my colleagues here, and from a purely unbiased point of view, I'll tell you that they are the hardest working organ in the body. They filter the blood and remove waste. They regulate the fluid balance in the body. They control blood pressure. They release the hormone that tells the bone marrow to make red blood cells, and they activate vitamin D, which helps the body absorb calcium and ensure healthy bones. They also control the acid-base balance in the body, maintain a balance of electrolytes critical for proper functioning of the heart. Clearly the hardest working organ in the body. Next slide, please. Since the kidneys perform all these functions, it's not surprising that when they're no longer functioning, all the problems you see on this slide become an issue in the setting of chronic kidney disease, which from now onwards, I'll simply refer to as kidney disease. And so in no particular order, things like high blood pressure, anemia, weak bones, poor nutrition, nerve damage, heart disease, and kidney failure start to manifest. And as the popular song by Johnny Mitchell goes, don't it always seem to go that you don't know what you've got till it's gone? That's what happens with kidney failure. Next slide, please. So what are the risk factors for kidney disease? As listed on this slide, they include diabetes, high blood pressure, family history of kidney failure, older age, high-risk population, and I highlight Black/African Americans, and other high-risk populations, including Hispanic Americans, Asians, Pacific Islanders, and American Indians. Next slide, please. So kidney disease affects about 26 million Americans, and African Americans have up to a fourfold greater risk of end-stage kidney disease. African Americans, as you know, comprise 12 to 13% of the population, but make up almost 1/3 of the dialysis population. The National Kidney Foundation estimates that 1 out of every 3 adults, approximately 80 million people, are at risk for kidney disease. And kidney disease is the 9th leading cause of death in the United States, killing more people than even breast cancer or prostate cancer, according to the CDC. It is the most under-recognized public health crisis in the country. Next slide. This is data from the United States Renal Data System from 2000 to 2018. This is a national longitudinal data system that collects, analyzes, and distributes information about kidney disease and end-stage kidney disease in the US. In this graph, the red line on top represents data from Black patients. The gray line represents the American Indian or Alaska Native patients. The green line shows data for Asian patients, and the navy blue line shows data for the white patients. The graph on the left highlights that the adjusted end-stage kidney disease prevalence in Black patients, that's the burden of the disease as shown in the red line, was 3.4 times higher compared to that of whites as shown in the blue line at the bottom as of 2018. Similarly, on the right side, the graph there highlights higher adjusted end-stage kidney disease incidence, so the rate at which new cases develop among Black people as shown in red line. So we know that there is an elevated risk of end-stage kidney disease in Black people and African Americans relative to all other racial groups and starting from a very young age of around 30. Next slide. Having understood the magnitude of the problem, let's talk about kidney disease screening. There are 2 simple ways to test for kidney disease. We can screen for kidney disease through the urine or through the blood. And we'll start by discussing the urine test. Next slide, please. So too much protein in the urine is known as proteinuria, and it's an early sign of kidney damage. The body needs protein, but it should be in the blood, not in the urine. This slide highlights a healthy kidney on the left, and as you can see, the protein as shown in the brown circles is contained in the blood where it should be, and it's not leaking into the urine. However, in the damaged kidney shown on the right, the protein is leaking out from the blood into the urine, and this can be a sign of early kidney disease. When the urine test comes back positive for protein, it's usually repeated to confirm the results, and the presence of 2 or more positive urine tests over the course of 3 months is a sign of kidney disease. Next slide, please. The table on this slide describes the albuminuria or proteinuria categories in kidney disease. The albumin to creatinine ratio is calculated by dividing the amount of urine albumin or urine protein by the amount of urine creatinine. And when you have an albumin to creatinine ratio below 30, it's considered normal. If it's between 30 to 300, the person may have moderately increased amounts of albumin or protein in the urine. And when it's above 300, it means that the albumin or protein in the urine is severely increased. Next slide, please. Now let's talk about the blood test for kidney disease screening. The creatinine is a test which measures the amount of creatinine in the blood. Creatinine is a waste product from the normal wear and tear on muscles in the body. Waste products like creatinine are filtered out of the body by healthy kidneys, and they leave the body through the urine. If the kidneys are not working as well as they should, the amount of creatinine in the blood starts to increase. Therefore, measuring the amount of creatinine in the blood is used to check the kidney function. However, the normal creatinine level can depend on biological variables, including age, gender, and body size. And aside from chronic kidney disease, creatinine levels can also be affected by other factors such as diet, muscle mass, malnutrition, and other chronic illnesses. So what is considered high for one person might be normal for another. Therefore, when you get this test done, it's safest to have your doctor interpret the results and help you put these results into context. Next slide, please. The creatinine result is used in a mathematical formula to estimate how well the kidneys are working. And this formula is what is known as the glomerular filtration rate, or the GFR. It's a mouthful, just remember filtration. The GFR reflects how well the kidneys are filtering and removing waste and extra water to make urine. This slide gives you an idea of how to interpret the GFR. It's important to note that the GFR declines with age, even in people without kidney disease. A GFR of 60 or higher is in the normal range, in quotes. A GFR below 60 may mean kidney disease, and a GFR of 15 or lower may mean kidney failure. It's important to recognize that kidney disease does not typically cause symptoms until it's in a very advanced age. Therefore, it's important to get screened for kidney disease if you have risk factors, including diabetes, high blood pressure, if you're overweight, you have a family history of kidney disease, or if you're a Black person. Remember that as Black people, we have an increased risk for developing kidney disease. Next slide. I want to say a quick word about the move from race-conscious to anti-racist approach to kidney disease estimation. Some of you might have heard of it, but based on the premise that race is a social construct and not a biological variable, there was a strong push to remove race as a variable in the eGFR equation. And this battle was actually initiated by medical students across the US and gained national interest during this pandemic. It led to the creation of a task force, a joint task force by the National Kidney Foundation and the American Society of Nephrology. And in February of last year, the task force published guidelines recommending that race should no longer be included in the kidney disease estimation formula. And later that same year, a group of us at Vanderbilt provided the first systematic level evidence in support of the removal of race from eGFR. Next slide, please. So the only way to know if any of us is included in the 33% of our Americans who are at risk for kidney disease is simply by getting tested, because we cannot test, we cannot treat what is not diagnosed. So one wonders, why are we as Black people in the community still hesitant to take advantage of free kidney disease screening opportunities when available? So in the next part of this talk, I'll switch gears to share briefly with you the results of a study which we conducted describing the perspectives of African Americans regarding kidney disease screening. Next slide, please. We were motivated to conduct this study based on an article published in 2005 by two prominent Black nephrologists shown on this slide, Drs. Keith Norris and Lawrence Agodowa, who have done significant work describing and addressing existing racial disparities in kidney disease. In this article, they highlighted the importance of screening programs in identifying individuals at risk for kidney disease, and they stressed on the need to provide early treatment and advice following diagnosis. Next slide, please. Therefore, a group of us at my institution took up this challenge to better understand the perspectives of African Americans on barriers and facilitators to uptake of community screening for kidney disease. Next slide, please. The question we asked was, what are the barriers and facilitators to uptake of freely available community kidney disease screening among African Americans? And to answer this question, we conducted 3 focus group sessions in African American churches in Nashville with a total of 32 participants. And we asked questions to explore views on kidney disease related information, access to care, priorities of kidney disease health, and opinions on community screening. And we analyzed the data and discovered some key themes that emerged. Typically, I would let you read these illustrative quotes on the right by yourselves, but in the interest of time, I would just highlight really quickly that the barriers that came up included things like knowledge themes. So lack of kidney disease education and testing was highlighted, and someone said, I bet Black Americans get this disease more than anyone else, yet a lot of information is not out there. Low trust was also highlighted, and someone said some people in the Black American community just don't trust certain doctors, don't believe that they're getting what they need. And kidney disease related fear came up several times. One person said, my fear is maybe I'm at risk for kidney disease. My mother resisted dialysis. My sister is on dialysis. And financial burden was emphasized, and someone stated that some people just can't afford to go to the doctor, so they can't get checked out until it's too late. Next slide, please. And moving on to also look at key facilitators of uptake of kidney disease screening as illustrated on this slide. Again, really quickly, The thirst for increased kidney knowledge and testing was one that came up repeatedly. One of the participants said a lot more education needs to be provided so people can have more awareness. Culturally sensitive strategies were highlighted. The influence of church leaders was emphasized. And one person said, if health fairs are marketed from the pulpit, it will help a lot. A lot of people trust and believe their minister. And then enhanced communication strategies came up. And an illustrative quote was, well, doctors really need to work at enhancing their teams in their clinics and hospitals to reinforce and clarify with patients and families. And finally, convenience. People wanted to be entertained in addition to finding out about their diagnosis or risk factors. And someone said, well, that's the way our culture is. So this study highlights the need to listen and integrate the perspectives of African Americans in the community regarding ways to increase uptake of free kidney disease screening services. And our take-home point was that there's need for strong collaborative partnerships with community leaders and stakeholders. There's need for effective community engagement and provider-delivered culturally sensitive education that will increase trust, decrease fear, maximize participation, and early identification of kidney disease among Black people. Next slide. Since we have this wonderful opportunity to connect today, I would like to end by sharing with you some basic information about the link between genes and kidney disease. So I'll switch gears at this point to discuss this, starting by referencing this paper published in 2010, which highlighted the novel association between the high-risk variants of a gene known as APOL1 and kidney disease in African Americans. Next slide, please. On the left of this slide, you see a map of Africa that shows the distribution of the APOL1 high-risk variants across Africa. The figure on the right highlights the slave trade routes and shows that these routes originated from the same part of Africa where these high-risk APOL1 variants are found. And these variants are known as the G1, G2 APOL1 variants. They're found in different combinations. And these variants arose actually about 3,000 to 6,000 years ago in Africa. And they are associated with resistance to the lethal form of a disease known as the African sleeping sickness. And these high-risk variants are only present in people of African descent. Next slide. This is a picture of trypanosomes, which are parasites found in Africa. They are transferred from the gut of the tsetse fly to humans by bite. They live inside the human body, they multiply rapidly, and they cross the blood-brain barrier, causing something known as the African sleeping sickness. So the high-risk variants of this APOL1 gene, which I've mentioned previously, offer protection from these trypanosomes. So they are on one hand protective, on the other hand, now shown to be associated with kidney disease. Next slide. These same high-risk variants protective against the trypanosome parasites are linked to kidney disease. And I'll highlight this with this slide. The left side of this slide illustrates that about 13 out of every 100 African Americans have the high-risk variants of the APOL1 genes, as shown in the figures in orange. And on the right side, you will notice that about 2 to 3 of the 13 people with the high-risk APOL1 variants will go on to develop kidney disease that is linked to that gene. So not everybody with the high-risk variant goes on to develop kidney disease associated with it. Next slide. So knowledge of this APOL1 gene and its connection with kidney disease is still evolving. There are things we know, things we don't know. We know that these high-risk variants have been associated with faster progression of kidney disease with and without diabetes. We also know that they're associated with a greater risk of kidney transplant failure. However, we do not yet fully understand the biological mechanisms that link these variants to the risk of kidney failure. And we also don't know of any specific preventive ways to avoid getting kidney disease in the setting of having the high-risk variants. And we also don't know the correct way to approach testing. Next slide. As we reflect upon the principles of genetic testing, we also consider the ethics of genetic testing. So we are aware of the legacy of mistrust in the African American community. Stemming from the Tuskegee study, we also know that the missteps with sickle cell screening programs in the 1970s led to a lot of mistrust of genetic testing in the African American community, which has only been partially addressed by more recent positive programs. So given this mixed history of genetic testing in African American communities and significant uncertainty about what to do with knowledge of a positive APOL1 test, there is still a lot that is unknown, and it is imperative that we involve members of the Black community in general as we discuss ways of using this test in routine patient care and in the context of kidney transplant. Next slide. So finally, circling back to this slide, as you probably guessed, this patient had never been screened for kidney disease. He had no idea that he was diabetic and hypertensive. He was confirmed to have chronic kidney disease stage 5. He showed no signs of renal recovery during his hospitalization, and he became uremic, which means the unfiltered toxins in his body accumulated to the point where he started having symptoms due to kidney failure. And as you can imagine, he had to be started on hemodialysis urgently. So I leave all of you with a clear message that as Black people, we are at risk of kidney disease. Therefore, I empower all of us to take control of our health, to start by taking advantage of any opportunity to get screened. If you haven't yet been screened, follow up with your PCP to discuss results, be your biggest advocate, and please spread the word. Next slide. Thank you again for the opportunity to give this talk today, and I hope I covered it all. Thank you.
Thank you, Dr. Umeukeje. As a reminder, please place all of your questions in the Q&A box. We will be sure to either get to them directly or answer them electronically as we go along. Before we transition to our next speaker, I would like to give our chapter president an opportunity to address the webinar. Welcome, Madam President.
Thank you so much, Dr. Stewart, and I am so excited to be a part of this wonderful presentation. I won't take long because it's more important for all of you to learn more about kidney disease from these experts than for me to talk. But it is my pleasure to be a part of the Black K.A.R.E Chronic Kidney Disease Series. The national chapter of the Links Incorporated is celebrating its 70th year of friendship and service. What I am most excited about with this series is that we have 2 of the sister chapters in the Nashville area that are collaborating with us. And we know that we are much stronger together. We are committed to providing relevant and impactful programs designed to meet the needs of the Black community. CKD is a problem that disproportionately affects the Black community. And as we've talked about before, it's estimated that 1 out of 3 adults are at risk for this problem. We know ourselves, we know our issues, and it's time for us to get serious. For me, learning about CKD is essential. My mother's 2 youngest siblings both died from complications of kidney diseases. I think it's important that we all learn this information, and I thank you for being here tonight. Thank you, Dr. Stewart.
Thank you, Chapter President, for link sharing. To motivate you towards your health goals, the first 10 community members who log into each webinar will receive a Black K.A.R.E cookbook. Please check your email for this offer in the coming weeks. We will now hear from Dr. Charlene Dewey, who will give us key information about kidney health, wellness, and healthy goal setting. Dr. Dewey is a professor in the Division of General Internal Medicine and Public Health within the Department of Medicine at Vanderbilt University Medical Center. She also holds an appointment in Vanderbilt's Department of Medical Education and Administration in the Division of the Office of Teaching and Learning in Medicine. Dr. Dewey is an Assistant Dean for Educator Development, Chair of the Faculty Wellness Committee, Co-Director of the Center for Professional Health, and Director of the Educator Development Program. Welcome, Dr. Dewey. We can't wait to hear what you have to tell us tonight.
Well, thank you so much. Thank you to everybody. Thank you to all the wonderful links chapters in the area of Nashville for the collaboration. Thank you, Madam President, and a special thank you to LaMonica, Link LaMonica, and Link eToy for organizing this presentation. Next slide, please. So I'd like to talk to you a little bit about health in 2023, focusing on kidney health and making good goals and keeping good goals. So my question, of course, is what do you want your health to look like in 2023? Next slide. So as you reflect on that, please take a moment. We're going to launch a poll that says, do you want to be healthier in 2023? And you get to choose yes, definitely, yes, maybe, no, or unsure. And we'll give you about 10 seconds to vote before we close that poll. And if we have a good number of responses, we can go ahead and close the poll and display the results. I see a lot of people are answering in the chat. All right, so we have 98% saying that they would yes, definitely want to be healthier in 2023, and 2 for yes, maybe. Thank you very much. You can close that. And next slide. So since you all are willing to be healthier in 2023, I'd like to start big and then narrow down to kidney. So if we look at dimensions of wellness, I like to narrow it down to 4 dimensions of wellness: your personal wellness, your professional wellness, your relational wellness, and your life wellness. So personal wellness is what we're going to focus on next. But then professional wellness, just as a little point, is that's your occupation, your career, the environments that you work in at work, and your financial stability. Whereas relational wellness focuses on everything related to your relationships, your intimacy, love, sharing love, giving love, receiving love, social, and your communication skills, such as how you communicate, how you handle conflicts. And life wellness is that part of what do you believe is your purpose, your value, your meaning? Why are you here on earth? And then where is your happiness? Where's your home safe as far as your environment? And how do you process the challenges that you face in life? So we're going to focus on personal wellness, which is physical, mental, go ahead, next slide, emotional, and spiritual. So we think about physical as anything we do with our body. Mental is our mental health and our well-being around how we handle some of the challenges that we have in life. Sometimes we also have conditions like depression or anxiety that go into our mental health. And then emotionally, how do we feel emotionally, and how do we nurture and maintain our emotional well-being? And our spiritual side. So how do we also help advance and nourish our spiritual well-being? Today, we're going to focus a little bit on physical, and the next webinar has some physical, and the third webinar is going to focus a little bit on spiritual. Next slide. So if we think about physical wellness, and again, that's your physical, mental, emotional, things like that, but this one focusing even more into the body and what that means. Our physical health starts basically when we are in utero as a fetus, and when we're born, and as we grow as a child into mature adults and even to our senior years. There are many organs within the body that we want to focus on. So a lot think about health around heart or lungs or your intestinal system, your GI system, but your muscles, your brain, your dental health, your ears, nose, and your eyes, ophthalmology, ocular health. Today, we're going to focus a little bit on that kidney health. And so you heard the wonderful presentation about the importance of kidney health. So next slide. So I want to introduce to you this little activity that you can do on your own. And I'm getting ready to put it in the chat because, oops, hold on, let me get it again. Because the National Kidney Foundation has a little assessment that you can do. So I just put that webpage in the chat. And if you click on that, it will give you the option to answer a few questions. It's about 8 questions. It's not very long. And depending on what you put in that assessment on those 8 questions, they'll ask about diabetes and hypertension and your weight and things like that. And you get a little bit of a reading like you see on the screen. And it says, based on your lab results, your kidney health is blank. And so I put in a couple of different numbers from some general patients that I've seen in my clinic, and it came out as fair to good. But the beautiful thing about this is that they provide an individual learning plan. So depending on what you answer in this little assessment, they give you very different things to learn about. So if you see the tile on the right-hand side of the slide, those were the topics that this individual would learn more about. So I hope everybody copies or opens up that link right now, and then you can save it and complete it later on. Next slide. So if you're thinking about improving your kidney health in the next year, please consider things like making sure your blood pressure is controlled. So going to your doctor, having it checked, checking it on your own. And if you take medicine, to take medicine appropriately and use any other requirements that your provider gives you. Controlled blood sugar is another one. So diabetes is also a major risk factor for kidney disease. And so the better we control our blood sugars and our A1Cs, then the better our kidneys can do. Being at a healthy weight. So finding out what your body mass index is, or BMI. There are BMI calculators on the internet that you can put in your height and your weight, and it gives you a range of what's considered a healthy weight. And then those are also influenced very heavily by healthy diets. So how do you eat a diet that helps support good kidney health? And we're going to talk about that a little bit more in webinar 2. But in general, a good healthy diet with more vegetables and then fruits and proteins will be a nice way to balance it. And then physical activity, of course. You want to be as physically fit as possible. That helps lowers blood pressure. It helps reduce the kind of like the bad chemicals in your body that cause stress to a lot of your organs. And then, of course, most importantly, getting screening. So keeping your annual appointments with your doctors and being an advocate, like Dr. Ebele Umeukeje said, you know, be your own advocate. Ask your doctor, how's my kidney health doing? If you have diabetes, hypertension, especially, what was your last creatinine? What's your protein albumin levels? Those are things that you want to be empowered to ask your providers about. So next slide. So now we have another poll, item 2 and 3. If you go ahead and launch that one, the first one is, have you ever created healthy living goals in the past? Yes, definitely. Yes, maybe. No, or unsure, don't remember. And have you created kidney health goals? Yes, definitely. Yes, maybe. No, unsure, or don't remember. And again, we'll give you about 10 seconds to respond before we close the poll. All right, and then if we have enough responses, you can go ahead and close the poll and display the results. All right, so let's see, we've had 66% and another 19%, so about 90% almost that have created health goals in the past. So that's wonderful. And then have you created kidney health related goals? We have 32% that said yes, and another 17% that said yes, maybe, but we have 42% that are a no. So the question is then if you have any risk factors whatsoever and you do that screen on the Kidney Foundation page, maybe you might want to make a health goal. If you go ahead and close that display, and next slide, please. So now I'd like to introduce to you a model that we call the intent to change and goal keeping. This is based on Stephen Covey's The Power of Goals, and it's about translating vision into actionable, achievable doing. And so when you write a personal wellness goal, you want to do the right thing for the right reason in the right way. Next slide. Now, if you have the option to do a screen capture, please try to screen capture this model, or you might want to write them down. So first you might say, I intend to change the following. Well, maybe you've never been screened, or maybe you want to be screened, right? Or maybe you want to implement a healthy diet or more physical activity. That's your intent to change. And then we want to create an objective based off of the SMART model. And so you might consider thinking about these additional things. One, what are the barriers? What things might be in my way along every step of the process of implementing my goal that might thwart my efforts? And so you want to think about those barriers ahead of time so that you can anticipate them and get over them. We also know that when you want to be successful at a goal, the more you have accountability, the better. So maybe have an accountability partner, maybe links in different chapters collaborate together and partner together, or church members partner together, or friends partner together. And this way you're both doing similar goals and trying to support each other. And even if you have different goals, to support each other, but it helps with accountability. Now, the SMART part is that specific, measurable, appropriate, relevant, and timely, meaning you want it to be very specific. You don't want to say, I want to be healthier and leave it at that. No, you want to be specific. I want to walk for 15 minutes every day. That's specific. It's also measurable. It's also appropriate. It's relevant because it helps with your overall physical health, and it can be timely if you start now and you give yourself, 3 to 4 months to feel comfortable with doing it. We also build in rewards. So we say, if you walk for the first week every day for 15 minutes, what reward do you want to give yourself? You can bank your rewards. So if you want to give yourself a bigger reward after you've done it for 2 weeks, then you give yourself a positive reward. But you want it to be appropriate. So you don't want to say, I'm trying to lose weight, and so I'm going to give myself a chocolate cake as a full dessert. You can have a piece of the chocolate cake, but not the whole cake. And then you want to evaluate your process and how it's going and find out if there's any barriers that you didn't anticipate. Work with your accountability partner for how it's going. Share your successes with each other. And then after a certain period of time, maybe we always say you have to do something at least 24 times before it becomes a habit. So if you do that, if you do your goal for 24 times and it becomes a habit, and you're now thinking this is my lifestyle, right? Because you don't want it to just be for a short period of time. You want to make good, healthy decisions that will be a lifetime worth of wellness. So then you decide, what might I do next? And how do I continue to build on my improvement for my healthier 2023? So that this way you're always working on something to improve your health over the year, all 12 months. Next slide. So Viktor Frankl gave a statement that says, even when it's not fully attained, we become better by striving for a higher goal. So every time you try to implement a goal, and even if you make it partially through, you're probably going to be better off than if you never tried. So give your efforts, try and do something, no matter how small it is. Next slide. And so in summary, good health and kidney health starts with awareness. So get checked and know your numbers. The next thing is to protect your kidneys. Make sure you have good health, because that's going to be maintained over your entire life. And then control your blood pressure, your blood sugars, your diet and salt intake, your exercise levels, and get screened. These are the very best ways to protect your kidney health. And then lastly, make a goal today that targets your kidney health. Next slide. So here's an opportunity for you. Those at St. Vincent de Paul, and then in conjunction with several chapters of the links here in Nashville, we're offering a free health fair on Saturday, March 25th of 2023, between 10 a.m. and 12 p.m. you can have free kidney health screening provided by Dr. Marquetta Faulkner and the Salt Wagon Clinic. Education, there'll be fun, there'll be gifts, bring the whole family because we're going to have great activities for everyone. St. Vincent de Paul is located at 1700 Hyman Street, but the actual health fair will be held in the St. Mary's Villas building or gym area. So make this maybe the first step in your overall health and wellness plan for 2023. Thank you.
Thank you, Dr. Dewey. We now have a few minutes for our experts to answer your questions. Joining me will be L.B. Gators, a beloved parishioner from St. Vincent de Paul and an alumna link from the Hendersonville area Tennessee chapter of the Links Incorporated. Thank you, LB, for joining us. Why don't you present our first question?
Sure can. This is from the first. At what age is kidney disease common? I guess that would go to whoever is ready to answer that. At what age, Dr. Ebele?
I can answer that. So kidney disease can occur at any age. I think what is important to keep in mind is that in Black people, we tend to see kidney disease. The risk of kidney disease is more commonly seen at a younger age. In one of my slides, I said that increased incidence that is seen among Black people starts from as early as 30 years. But in the reality is that even children have kidney disease, which is unfortunate. We have children on dialysis and we also have children who have received a kidney transplant.
Wow.
So it can occur at any age, yes.
Okay, and is an overweight person at risk for having kidney disease?
I can take that too. So obesity is one of the risk factors that's directly associated with kidney disease. There are some factors that we know have a direct link with kidney disease. Obesity is one of them. Smoking is also one of them. So increased, risk of those is directly linked with increased risk of kidney disease.
Right. And I think this would probably connect with that. Dr. Dewey, what about a diet for people with kidney disease?
Well, that would definitely be something you want to talk to your primary doctor about and talk to your nephrologist. If you have kidney disease that's significant, I'm a believer you should also have a nephrologist like Dr. Umeukeje, because they are going to be focused on very specific things. And you want a nutritionist, okay? So you want to have somebody who's skilled and understanding and educated in that area. You don't want to look up too much stuff on social media on some of the web pages that are out there, because you can take stuff that can actually hurt your kidneys more than help your kidneys. So I always start with basic things, which includes just healthy, fresh kind of foods. Try to avoid what I call the center of the store. So if you buy all your foods and from the fresh fruits and vegetables and the meat areas, and you reduce the things that you buy off of a shelf, because those generally have high salt in them, that would be one place to start. You can also start with adding more fish into your diet. So replacing red meats with fish is also a nice one because it has higher levels of omega-3 fatty acids in there. And that's better for you than red meat kind of protein. So it also, there's more that goes to that. So I'm not going to try and cover everything in one question, but Dr. Ebele, do you want to add anything to that?
Thank you, Dr. Dewey. I would just add, a lot of times patients come and they ask us about specific recommendations, dietary recommendations in kidney disease. And one of the things we tell patients is that the dietary recommendations in kidney disease oftentimes depend on their labs. And so like Dr. Dewey mentioned, working with your PCP or a nephrologist to be able to figure out those dietary recommendations that match your lab abnormalities. So for instance, some people with kidney disease have high potassium levels. And so those are the people we tell that they have to avoid foods that are high in potassium. So bananas, potatoes, avocados, spinach, etc. But people with kidney disease who don't have high potassium can consume those things. So it becomes cumbersome for patients to manage on their own. The best thing is to work with your doctor and also work with a renal dietitian to match it with what your needs are. Yeah.
Excellent.
This has been a great discussion, but unfortunately, we need to go ahead and end the question and answer session due to time constraints. But I do want to thank our panelists as well as LB for facilitating the questions. Again, we're so grateful for our panelists for joining us. Again, as they say, when you know better, you do better, and it's now our job to do better. We now want to take this time to let everyone know that there are free healthcare services available through the Meharry Salt Wagon Clinic. Dr. Kimberly White Etheridge will tell us more about the Salt Wagon Clinic services and the upcoming health screening events offered through a partnership with Black K.A.R.E. Dr. White Etheridge.
Good evening, everyone. It's a pleasure to be on and to be part of this wonderful presentation and to be able to give information on behalf of the Salt Wagon Clinic. As mentioned, the Salt Wagon Clinic is at Meharry. It is a student-run, student-organized, student-founded free clinic, of course, with faculty physicians here at Meharry, with the purpose of addressing healthcare disparities within our community by providing free, high-quality care to Nashville's underserved populations. At the Salt Wagon Clinic, they're able to offer primary care visits, prescription medications for free, diabetes and glucose testing, flu vaccines, vision testing, blood tests, other blood tests that might be needed, as well as our kidney screenings. So for anyone who may not have insurance, may be underinsured, then they're able to come to the Salt Wagon Clinic. It meets Thursday evening from 5:30 to 8:30. And I will put the phone number for appointments in the chat. Walk-ins are welcomed. However, of course, patients that have appointments will be seen first. So if you are underinsured, if you're not insured, if you know anybody who needs that care, then please refer them to the Salt Wagon Clinic and make sure that we're taking care of our community. And as I mentioned, I'll put the phone number for appointments in the chat. Thank you.
Thank you. In our remaining minutes, we will tell you about our Black K.A.R.E giveaways. So for those of you who asked in the chat, is there a survey? I'm about to get to that. We have Black K.A.R.E recipe books, and we'll offer them to the first 10 people from the community who join each webinar. We will also offer books to the first 10 people who enter a question in the Q&A for each webinar. Now, if you qualify, you will receive an email from us with more details. We are also offering Kroger gift cards. Gift card dollars can be used for the healthy food items that we need to keep our risk for CKD low. To be eligible for the gift card, you should do one of three. You need to do the following three things. 1, register for the webinar series. 2, complete the survey using the link that will be placed in the chat. We will also include the survey link in an email that you should receive tomorrow. And 3rd, agree to get an online CKD screen through the National Kidney Foundation. The link to the National Kidney Foundation website will be in your survey. Now, it takes about 3 minutes to answer a few general questions, and they will then email you a personalized risk assessment along with information about CKD. This is a valuable resource that we want everyone to take advantage of. Everyone who completes a National Kidney Foundation screen and attends at least 2 webinars will be eligible for the $30 gift card giveaway. Those who attend all 3 webinars will be eligible for a $50 gift card giveaway. Thank you again to our speakers, Dr. Umeukeje and Dr. Dewey. We are now at the end of the hour. Please join us next Thursday, January 26th at 6 p.m. Central, where we will focus on CKD disparities in the Black community, prevention strategies, and hear from experts about nutrition and exercise. Remember, you can use the same Zoom link that brought you to today's sessions for those sessions. This webinar was brought to you by the Nashville, Tennessee chapter of the Links Incorporated in partnership with the Music City, Tennessee and the Parthenon, Tennessee Links chapters. We have an exciting partnership and look forward to successful in-person health, wellness, and kidney screening events in the future. Thank you also to our St. Vincent and Metropolitan Interdenominational Church partners for asking such insightful questions in the chat and Q&A box. To learn more about the Black K.A.R.E initiative and CKD, look in the chat for the Black K.A.R.E website link. We will also place more information in your post-webinar survey. On behalf of the Webinar Planning Committee, please have a great evening. Good night.